overseas. There we go, recording as well. So we're gonna call to order the October 22nd, 2025 CSAC meeting from 9 to noon. So we will start with call to order and roll call. Don, if you could do roll call, please.
Ron Antony.
Present.
Julia Tella. Kim Britt. Amber Brown. Molly Bruner.
Here.
Carter Deers.
Here.
Jessica Frolick. Michelle Frisbee. Michelle? Saw her online, but Cami Guns. Kevin Glass.
Here.
Tracy Green.
Here.
Nicholas Henderson. Don Lanoy.
Here.
Marlon Manzaros.
He was, yeah.
Okay.
He was on there, Don.
Yeah, I know. I saw him on there. Kelly Mitchell is not here. Kurt Mortensen.
Here.
Becca Muscat. John Priam. John Shiro.
Here.
Toby Stevens. Lane Sutherland.
Here.
Jennifer Verdea.
Here.
And Barb Weckman-Brecky. Okay.
I don't know if you saw the screen, but Michelle put a comment up that she's there and working on her.
No problem.
Yep.
Thank you. I didn't see that. So let's see. 1, 2. We do have a quorum.
Thank you, Don. And we will move on to the minutes and the agenda approval. The minutes were sent out with the package. I hope everybody had a chance to review them. Any comments or questions or updates on the minutes? Hearing none, we would then move on to the agenda. Agenda as well was sent out with the packet. Any updates to the agenda?
There is an update. I've got the current agenda here. We're just flip-flopping the risk and needs policy to be the first policy reviewed.
And that is on the most recent.
And that's on the most recent one that's here. It was not on the one that was sent out because that was yesterday afternoon that came out. So
Perfect. Thank you, Don. So risk and needs will be under new draft policy. We'll start with risk and needs assessment policy, move on to the IPV, and then finish with the case planning policy. So hearing no additions, we would entertain a global motion for the minutes and the agenda.
This is Julie.
Julie, so we have a motion from Julie online and a second from Kurt. Thank you. So we have a motion and a second. Any additional questions or comments? Hearing none, Don, if you could do roll call, please.
Ron Antony.
Aye.
Julia Tella.
Aye.
Kim Britt, did you make it online? Molly Bruner.
Aye.
Carter Deers.
Aye.
Michelle Frisbee.
Michelle
Yeah,
says, or you see that chat?
Yes.
okay. Yep, I see that. So Cami Gens. Kevin Glass.
Aye.
Tracy Green.
Aye.
Don Lanoy.
Aye.
Marlon Mazaros. Marlon, if you can just type it in too.
Seeing nothing.
I'm not seeing anything. So Kurt Mortensen. John Shiro.
Aye.
Lane Sutherland.
Aye.
Jennifer Verdea. And Barb's not here. And that is a pass. With a few abstentions due to problems.
Thank you, Don. So then we'll pass it over to Molly to move to the next.
All right. So we are going to move into the new draft policy review items, and we do have 3 policies that we are going to walk through today. And as a reminder, from the review last time when we walked through the process for this, right now, what we're going to do is there's a representative from each of the subcommittees that will be walking through and presenting the policy. And then what will happen is discussion today, related to any of these policies. And then for the delivery systems and for the, entities that you're representing as CSAC members, you'll be bringing that back to your respective areas for further input from your folks. And then coming back next month, they'll be put back onto the agenda for, again, discussion, bringing back the input again from all of your respective spaces, and what discussion will be had if, again, do we move forward that day or next month? Do we need to bring that back to subcommittees for more work, right? So it's an iterative process. It's recursive, so it's not a linear process, but if we get to the space like we did on the training QA policy, then we can move it forward for approval as well. Questions about that before we kind of go into the first policy?
I do. So does it just for moving things forward, is it more common that we would ask clarifying questions today and getting more information just to gather the information today?
Yes, thank you. So that is a part I missed. So thank you, Carter. We also could have this discussion and give it back to the subgroups before we bring it to our respective spaces as well. So that's another option. So we have a variety of options, but today is definitely discussion, QA, trying to really understand kind of like how did the group get here?
Yep.
And then, yes, we make that decision. Does it go back to the subcommittee? Do we bring it back to our respective agencies for further discussion? And so it's not really, I don't think, a formal vote, but it's kind of where do we move the discussion to the next stage after we review these 3 policies today? Other questions or comments about the process before we get into content? Okay, wonderful. Well, then we have Tessa Nelson first for the risk and needs assessment policy. Thank you, Tessa, for being here. And then Don, will you be pulling up the policy online for folks so we can follow along that way? And appreciate you being here, Tessa.
Yes, good morning, everyone. Can you hear me okay?
Ken.
Okay, great. Thanks for also letting me go first. I have a training from 10 to 12:30 today that I'm hosting, so I appreciate the opportunity to hop in quick. So the Hennepin County kindly updated and made it look much nicer than the policy I had drafted. So I really appreciate Julie Root and Hennepin County helping me out with that. So just shout out to them for that. So taking a look at this, do you want me to read every section, or should I just kind of go over the overview of everything? How specific do you guys want to go?
I think that you don't necessarily have to read it. I will
Okay.
say that we're talking about the definitions and terminology later. So I would say
Yes,
you could
okay.
almost like move to, or even start with the purpose and applicability, and then
Okay.
move into like highlights maybe and things that you want to, point out in particular, and then go from there.
So the purpose is to ensure the consistent use of standardized statewide risk and needs assessment framework across the delivery systems, community supervision agencies, to support accurate assessments of clients' likelihood of reoffending and the identification of intervention targets the measurement of behavioral change, and to provide a foundation for supervision, case management, and case planning, aligning with the risk needs responsivity, the R&R model. The applicability, who it applies to, obviously CCAs, CPO, and DOC. And then, as Molly just talked about, the definitions, we tried, I think we had the same definitions from the recent case plan one. So hopefully they kind of align. If not, those will need to be adjusted. But in the definitions, we have criminogenic needs, the DRA, what is a DRA? The LSCMI, what override, pre-screen, responsivity. Maybe able to go down. Thank you. And then responsivity, we did general and then specific. We broke that out a little bit. I don't know how fast, if I'm going too fast for you guys, I apologize. And then definitions of risk. What is risk need assessment tool? Definition of R&R model. What is a supervision agent? We tried to be consistent in our language. So hopefully we ended up accomplishing that, because we did have to go back a couple of times and change that to make sure we're consistent. Trailer tools, validation, risk assessment, and then the validation, revalidation. What is the definition of that? So for the policy portion, the assessment target population, the policy applies to post-conviction individuals ordered to community supervision within the following target populations. So felony level cases, gross misdemeanor level cases, and misdemeanor level cases identified as targeted misdemeanors under the statute, Minnesota Statute 299C10 subdivision 1E. And then the use of the primary risk and needs assessment tool. Supervision agencies must adopt and utilize the following primary risk and needs assessment tool. LSCMI, used for all targeted populations noted above. Again, so that'd be the felony, misdemeanor, and the targeted misdemeanors. A pre-screen assessment may be used to determine the need for a comprehensive LSCMI. So that's where we're allowed to use the pre-screen tool to determine if a full LSCMI is necessary or not. The DRA will be used for male identifying clients with a criminal sexual conduct conviction and or sexually related offense with sex offense treatment directives in conjunction with the pre-screen or LSCMI. And then we put in there, note the DRA is not validated for female identifying individuals. So this is somewhat of a change from something previously that I believe had come out, where the DRA is, it's recommended to use as the primary tool with the pre-screener to determine if you need to complete the full LSCMI or not. The use of trailer tools. Agencies may implement trailer tools to supplement the general risk and needs assessment. The recommendation was to have the tool be validated with a AUC of 0.64 via a minimum of 2 validation studies. We do have a list. The most recent version of the, oh, sorry, I apologize. I jumped ahead. You must use the most recent version of the tool. And the agency has a mechanism for initial certification, all trailer tool assessors in annual booster training or coaching for these tools. So you got to follow all the recommendations for that. All relevant data for the trailer tools is entered into the assessment management tool in CSTS. And then assessment requirements. Agencies must conduct a pre-screen and or LSCMI within 60 days of case assignment. That might be a discussion piece for you to bring back to your agencies, but based on discussions we had in the group, we felt 60 days was something that was going to be attainable for all delivery systems. When using a pre-screener, agencies must conduct the LSCMI on cases where a pre-screen indicates the need for a full assessment. If a validation LSCMI was completed within 12 months preceding the case assignment, a new assessment is not required. That's really looking at like those transfer cases and things like that. Or if you have a new case sentence within that time frame. At minimum, reassessments must occur annually for medium and high risk clients and or when significant new information arises. Assessment overrides. Overrides must be approved and documented with clearly stated rational. Okay. The outcome of the trailer tool assessment may be used as justification to override the risk level identified by the LSCMI. Agencies shall track and monitor the use of overrides. Further investigation into the appropriate use of overrides shall take place if overrides occur more than 10% of the cases. Tool validation and quality assurance. Pre-screener and LSCMI tools must be validated on Minnesota's supervision population. We are currently in the process of validating the LSCMI right now. DOC will coordinate revalidation in collaboration with all statewide delivery systems. Note, best practice indicates revalidation should occur at a minimum of every 5 years. Agencies must monitor the accuracy and consistency of assessments. And then internal controls. Supervisors ensure compliance with assessments, administration, and documentation standards. Audit trails for assessments, overrides, and reassessments must be maintained in electronic case files. And then the references at the bottom, and then some, we don't know this policy number yet. So, and I believe that's it. Any questions from the group?
Thank you, Tessa. That was a great walkthrough there. Yes, questions or comments from anyone?
I have a comment.
Sure.
There's a lot of work that was put into this and it looks amazing. Not that it was, not amazing before, but it's clear that we've had a lot of discussion and a lot of the things that I know that we were talking about throughout this whole process have been either addressed or something's been done with it. So I appreciate it. Nice job.
Thanks.
Question from someone who
Yes.
doesn't work
This is-
regularly in this area, but in the assessment requirements, when it makes reference to significant new information, is that a term that's readily understood?
Yeah.
Or, okay.
Yeah. So if you're in a situation where someone's situation has significantly changed, that might be a time when you might be assessed to.
Yeah, but in terms of what qualifies as significant, is that fairly?
Yeah, I think
Understood
most
throughout.
agents know that it means, commission of a new crime potentially, or, loss of a job, divorce, like something major that affects them personally.
Okay.
That may increase their risk in some of those
Yeah.
units.
Okay, no, thank you.
I think you're making a valid, though, why not put it in the definition section or examples
Yeah.
of that?
Yeah.
Especially for new agents that are referring to this, that might be, it certainly doesn't hurt to explain that and at a high level. Not, it could say something like, and not limited to, right? Because you can't write to anything or everything, but there's major things that Cammie just listed that we could use.
Yeah.
So I feel like that provides clarity.
Yeah, significant means different things to different people.
Sure.
Yep.
Yeah.
Sure.
And I caught the same thing, I had circled new information to me was, I felt like it's change of case status or offender status or some things. It's just not, you're gonna get information. It's more of, it's related to the client.
Sure.
But that was just wording and it's maybe just my hang up.
That's good.
One thing, Tessa, I know this is an area of your expertise, but when we were talking about the DRA and again, that you can use the pre-screen, well, really it's that, so we're saying use the DRA and the LSCMI becomes the trailer tool, if you will. In that scenario, if people are not using the pre-screener yet, or they're waiting for the statewide pre-screener tool to be developed and validated, again, implied, but for those that don't do that work often, even if you're not doing the pre-screener, you would do the DRA and then the LSCMI. I mean, it's not like you have to do a pre-screener. You would just do that to save some time. And if it was medium or high, you do the full LSCMI. Is that correct? Or your understanding? Yep.
Yes, it's to help identify those who have are polycriminal or may have some co-occurring issues that might need to be addressed. And so if the pre-screener scores or any pre-screener that's out there that may be used until we get the validated one, yes, that would be the recommendation.
Thank you.
Kind of trailing that when you talk about the assessment requirements under the 3, and it says if a new assessment or number 2, excuse me, D2, where a pre-screener indicates the need for a full assessment, do we need to identify that? Is it medium and high? Or is it just say, I don't think it, in the pre-screener now that we use, it doesn't say need for full assessment. It says medium or high.
That is a very good point.
You have, sorry, go ahead, Molly.
No, go ahead, Tessa.
Do you have then in your screener the where it says if scores medium or high, then needs full assessment?
That's what we have in our policy, but I'm just wondering if we're looking at statewide standard.
So that's something they can put in the, if we do a pre-screener
Yes.
statewide, they can add that, because WISC says it. And then the Hennepin County one is whatever they score there is equivalent to what the score would be on a LSCMI.
So I'm just thinking it just says if it warrants
Yeah.
a full assessment, I think each pre-screener could be a little different. And do we need to identify, or do we want to identify?
So I am part of this group with Tessa, and I know Cammie, you are too. We talked about making sure that this policy wasn't writing to the future because we don't know what that looks like. So this one actually still reads, Tessa, correct me if you, or to Cammie if you think, I think this was left in there with the assumption that the new Minnesota pre-screener will be a yes, no, and not a medium high. So this
Okay,
is
so
probably when we took out some of the other language, because we're not ready for that Minnesota pre-screener language yet, right? We will have to just adapt this when that comes to be. So I'm wondering then, to your point, Tracy, if it's a shift in where agency, because it depends on which pre-screener you're using. If it's an LSIRSV, then you're using the author's recommendations, or maybe it's your agency policy. If you're Hennepin and you're using more, so I think we just need to figure out what is the more neutral language that says like per agency policy or per tool recommendation that you're using. Because right now, we're not using yet, a standardized tool. So I think if somebody has any thoughts about that or recommendations on language about that.
Yeah, it was hard when we didn't have, we don't know what the cutoff scores. So I think we were just trying to use the language of letting on a case where a pre-screener indicates the need for a full assessment. So letting the pre-screener drive the decision.
Mm-hmm.
Which is implied then that the pre-screener that you're using, you're following their recommendations for when to do a full LSCMI. So I guess, I don't know if that's, again, good enough, a little better, just, yeah.
I think so.
Yeah. No, that's good, Tessa.
That's good. Okay.
Are we into picky yet, or wording or anything like that, or?
As long as it's substantive in nature, I think we can do that. Because I think this is going to go through from a period semicolon space.
Okay. Yeah, there's some typos down here. I'm not gonna worry about that. And I think I actually wrote that part of it, so picking on myself. Applicability, do we want to remain consistent? Some policies are saying Community Corrections Act counties, CPO, and some policies we're saying Minnesota Community Supervision Agencies.
Okay, no, that makes sense. Maybe I can add that when we talk about our definition too, or is that what DOC legal and policy folks do for continuity, you know, as part of their practice is make sure they're all reading the
Well,
same.
They might.
Also because should tribal be in here too?
Say again.
Tribal.
Should tribal be in here?
Oh,
too
you're right
then?
on. So
Yeah.
Minnesota, so that if we went with Minnesota
Yeah.
Community Supervision Agencies, which I think
Yeah.
the case planning policy does say,
Okay.
then it would just be easier.
Is that what we finalized on, was the language we want in all policies? Has that decision been made here?
For definitions or for
On
applicability?
applicability.
No, I don't think
Okay.
so. So I think that I'll add that to this following agenda item because we can kind of group all of this together to eventually come up with standardized language in a variety of these areas perhaps, yeah. So that's good. What else?
I don't know if I had my hand up.
Oh, there you are. Hi, Kevin.
Oh,
Good morning. So going back to the medium and high risk and reassessment. So I know we say that in this policy, but case planning policy talks about medium, high, and very high. So if we want to be consistent, where that very high fits into all this. And maybe when the LSCMI does a validation study, maybe we don't have a very high anymore.
Well, and I also have a question mark around medium because there's been the question, we haven't gotten to case planning yet around the capacity for being able to do that. After what we need, there's lots of like what ifs out there. And so are we to stay consistent, although we haven't gotten to the case planning presentation? You know, do we keep medium in there? Or do we say, you know, high and very high to your point, Kevin? I think it's maybe my opinion. I think it maybe is one that gets discussed after we hear all the policies because they're all, although we're writing them separately, they're integrated, right? So we probably have to see how all of these come to us, I guess. And do we have to make any shifts and or have that discussion with our respective agencies on capacity and like, what do we think about? Can we do reassessments on mediums, but we're not going to be able to case plan on them as an example? You know, do we take out mediums for now on this one as well as the case planning? So I don't know that we're ready to make a decision, I guess is my point. And
That's, yeah, absolutely. And if you're not going to case plan, then there's no reason to reassess, right? I mean, if you're not, I mean, this is part of case planning, is
Right.
assessment.
right, you may as an agency, but again, you always have that autonomy to do that because you may change your own supervision level. Because you may be case planning with medium and that's fine.
Mhm.
Nobody's saying you can't. It's just if you, but as a state
should be
mandate,
consistent.
right, exactly. We're saying then that, so maybe we are, I guess, suggesting that medium comes off this for now.
Well, when we make that decision, that remain consistent, I would
Yeah.
suggest.
That's a good point.
Are we keeping a list of things like that that need to be, you know, viewed for consistency throughout each policy? I mean, I think this is a good point that there's probably a few things that we want to just have a list of that we go back and affirm and make sure that that's consistent.
Absolutely. Yeah, this is one example, so we just need to keep that list.
I'm trying to think if there were others, but I feel like we've kind of talked about this before, but I don't remember them if we resolved
Sure.
them or not.
Okay, well, we have that noted. Marlon,
I just have, is not knowing question, is this done with software? Like, is there a software platform that you use to do all this, that like if there's a certain number, it could trigger, could be set to trigger a certain direction to go, or like to kind of answer the questions to standardize it? Or how is it, is this still more of a manual process?
so the pre-screener process is it depends on what you're using, I guess. Like for us in Scott County, we're using the LSIRSV, which is on paper still. And the score, things can be entered into CSTS, but it's not like an automated tool. I believe Hennepin's maybe, I don't speak for them, but I
it's
think
in the
it's,
assessment tool, and I think you can download that ability to have it pull from the assessment tool into your client.
the Minnesota pre-screener tool that we're looking to develop. We want it to be for sure automated and static, meaning it's really just shows up for every client. It's so that will be part of CSTS. Or at least it's one of the variables that we said we'd like to see happen basically as part of the development of that. And then the LSCMI is in S cubed statewide supervision system through the Department of Corrections and has an integration with CSTS as well. So agents will go in and enter the scoring in that interface. And so we do have that ability as well. The DRA, Tessa, what does that look like? I'm not familiar with how that is entered.
So for the DOC, the DRA, we do have an assessment tool. We have a bucket, but I believe most agencies are doing them on paper unless they've created their own assessment bucket.
I think Tessa, are the static and stable, are they in the assessment tool? I think they are.
In
CSTS.
In CST, I don't know of that.
I
They're
think the
in,
static and stable are in the assessment tool in CSTS, and then you just convert that into your paper form for the DRA.
Okay.
for the DOC, or are you talking other agencies as well?
I'm just talking about CSTS in general.
Okay. I know the DOC has access to an assessment bucket, and then you can link it to CSTS. But I do not believe that the DRA is it's an option to add the score. But the assessment itself, like the assessment that you need to complete, is not in CSTS. You can do it on paper and then add the score, the DRA score, in the assessment.
Right, I think the static and the stable are in CSTS assessment tool, but then you have to do the DRA separate technically. So we could maybe add the could we add the DRA maybe? It's gonna be a mandatory.
Yeah, we should.
So
put
the
that as a
DRA
note.
is the combined score of the static and stable.
Tessa, you said something in our subcommittee too, for educational purposes. Will you repeat that, which is like, what makes up the DRA? You said something like these two do, there's a third one that I'm forgetting right now that, do you know what I'm talking about? Could you explain that one more time?
Yes, so the full DRA is a static, stable, and acute. The DOC and other agencies have dropped the acute because it's typically a supervision tool, and it was changing contact standards too often. And so that was dropped as part of the DRA score. And typically it's just the static and stable. But what you cannot use is just the static in an acute, or just the stable in an acute. The static and stable identify risk and need.
Thank you.
Yeah.
Yep. So we will make a note because we're recommending this in policy to go back to like our CSTS exec group, or, as part of like our metrics or things that we need per these policies, to make sure that that is in a way that, yes, that we can make sure that people are doing it. Thank you, Marlon, for the question. Kevin.
Thank you. One suggestion, maybe comment for the case of the offenses that we're doing these on. I know we have the targeted misdemeanors and we just have listed gross misdemeanors, but maybe a suggestion is just having it as targeted gross misdemeanors, because we do get some traffic offenses that maybe not be necessary for these assessments.
Good catch.
Okay.
Well, I think we did talk about that a little bit too. I think, didn't we test at our meeting that you could use the pre-screener potentially on those and likely screen them out anyway?
Yeah.
So we did talk about that, and maybe we could talk about it more, but I think that's where we landed, is that, I mean, we get quite a few in our county too. So if you used a pre-screener, it'd be pretty easy to screen them out and move on.
Mm-hmm. As part of a requirement, you could just have a bullet targeted misdemeanor, gross misdemeanor cases too. Lane.
This might be in the weeds question, so, but what about, and it's more regarding the timelines, that 60 days regarding case assignment. How does the policy address like transfer situations? So if for individuals that might transfer to a new agent or a new county, does that need to be reflected, or perhaps it is reflected? And because I'm just curious about that.
That's in the transfer policy itself.
Yeah. Tessa, did you want to speak to that, or we can? It's up to, go ahead.
We actually kind of had in the group kind of a big discussion because originally this said 30 days. And then some agencies were saying we need more time, but yes, the transfer policy would still take primary over this. So if the transfer policy states you have to have an assessment with the transfer, you still would need to have an assessment with the transfer, even if you're transferring it 10 days after sentencing.
Okay. All right.
Am I correct, Molly?
Yep, that's right.
Okay. Yeah.
Yeah,
that was my
that's
understanding.
a prerequisite to transfer. So like it has to be done, otherwise you can't do the transfer. So that's going to be baked into that policy. So actually, in some ways, that sometimes happens faster than this policy may provide. Yeah.
All right. Thank you.
Yeah. Thank you. What else? Well, this is, yes, thank you, Tessa. Very good work and leadership on this committee. Appreciate you and the time, and I hope you have a great training today.
Thank you.
I just pulled up the one statute where it talks about targeted misdemeanors, because then I was thinking about that language of targeted gross misdemeanors. I don't think that there's a great definition of that, so that could maybe open some confusion if you're saying targeted gross misdemeanors. So I kind of like that idea of it potentially being screened out early, but you might just have to look at the language a little bit, because I just don't see, I see targeted misdemeanors and there's obviously a clear definition of that, but that could open to some confusion.
Thank you. Go ahead.
Because we also talked about, could it be gross misdemeanor person offenses? But then we had that discussion too, that what's the definition of that? And it just seemed like leaving it as gross was easier all around for all agencies because you can.
The only other question that I'd have on that, or do you want, is a suggestion that you would want it to say non-traffic gross misdemeanor? And then you're still screening out other ones that might fall into that, or leave it?
Wouldn't a DWI be a traffic?
Yeah, then
Oh, I see what you're saying with that.
Yeah.
So you wouldn't do that. And then you start to do all sorts of like non-traffic except DWI, and then all of a sudden you're like, why don't we? Okay, well, thank you for looking that up. I appreciate it, and that makes a lot of sense. I'll just ask one more time. Other questions or thoughts before Tessa hits out? All right, well, thank you. Have a good day.
Have a great day. Thank you.
Okay, so then, although again, not formal, I am sensing that we're okay with this policy being brought back to our respective agencies for further analysis and discussion for next month. And does anybody object to that process? So we'll do that. And then we'll put that on the agenda for next month. All right, next up is the IPV policy, and we have Tracy Green here.
Yeah, sorry, I gotta just pull up my document here.
Hold on.
So this was brought to the CSAC a few months ago. And some suggestions or discussions were brought up and asked to bring it. So we brought it back to our Domestic Violence Steering Committee and reviewed it, and now brought back some of the clarification, hopefully, on some of the language previously. So I'll start with the purpose is to promote safety and establish consistent victim-centered reunification procedures for working with victims, at-risk persons, and clients with a history of intimate partner/domestic violence. So I know we use the word intimate partner, but statute uses domestic violence. So that was one of the questions that was brought up. So we entered it in there with including both of them. The IPV policies is different, but just so there's no clarification there that we want this process used on domestic and intimate partner cases. Applicability, I know we put in there the Minnesota Community Supervision Agencies, as we talked about. And then we just put some additional language in here relating to the cases. And I don't think there was any discussion about that at the last meeting. Definitions, we did, there was some question about the at-risk person. So we tried to simplify that a little bit and leave it kind of general. And that risk person was not a victim of the case, but a person who's maybe in a relationship, et cetera. We want to make sure that that at-risk person is considered in reunification processes. I don't think we did much in procedures. Just stepping back a bit, I was looking at some of my notes. One of the things that was brought up last time we brought this forward too is the IPV intimate partner violence principles is kind of more of a encouragement and, versus policy driven. So we try to tighten up that language a little bit, make it a little stronger than what we use in the IPV principles policy or principles, and then the policy make it more like this is a expectation, not just a suggestion. Just trying to think if there was anything else that I went over. Going down then to determining appropriateness under C. There was some question, it previously said a step down approach, and there was some asking for clarification on that. Our intent was saying that, when you're working with these clients, you don't have to say all contact or no contact, you can do it gradually. So we tried to change that language to make it more clear versus saying a step down approach. So as you can see in that language, it's changed a little bit from the last time. And then I think the only other thing that we addressed was the training question. And we had put in here within the first year of employment in a specified position, meaning if you're working with IPV, domestic violence or victims, supervising agents and DOC facility case managers must complete standardized training on IPV principles and a victim-centered approach to corrections. And then it talks, the training must be approved by the Domestic Violence Steering Committee, which now includes victim-free, violence-free Minnesota and corrections agencies. So I think those are the only things there was question on or needed clarification on last time. But I'm happy to answer any questions, have any discussion.
Absolutely. Thank you. So we will open it up for folks to, yes, Mr. Carter.
I'll be Pollyannish first. This reads really, really well. This reads really nice. And when I asked this question, I think I know my answer, but I have on B4 reads there's an active release of information signed by the client on file that allows the agent to communicate information to the victim at-risk person. So when I read that, I was like, doesn't it provide for that in 611A? And so I read it and I don't think it does. And so when my concern, I guess my concern is maybe it's not even a discussion for here, but I'm curious if this is just common practice that agents just communicate without a release, first of all. And secondly, if that it's in there and it does provide for it somewhere else, and so we don't need it, that it's going to block that communication. And maybe I'm being, the sky is falling a little bit here, but does anybody else have any concerns about that or not? Otherwise, we can gloss over it.
I think we didn't discuss it about is there other statutes that allow or prohibit it.
Right.
Wasn't discussion, but it was just encouraged with discussion. What was exciting for me and with the Domestic Violence Steering Committee and creation of this policy is it wasn't just corrections people sitting down and writing a policy pertaining to working with these people. It included Violence Free Minnesota and advocates and people that gave us input saying, if you guys got releases of information, it would better communication with the advocates, with the victims, with probation. And so it was that's really best practices, is to get that release and we can all communicate for the safety of the at-risk person or the victim. So that's as far as we took the discussion in writing the policy. But if there's other statutory language or you feel it prohibits something.
I just wouldn't want this to prohibit me. That's all I'm saying.
Yeah.
And in a lot of these policies, there's gonna be a lot of new things, right? And so
Yeah.
maybe this is just a new practice that they're just gonna have to get used to, and that's fine.
That's how we left the discussion, but I sure would bring it back to the committee if you feel that there's some concern with that.
Mhm.
Maybe a good answer for attorneys online, if we have the language in there and there's a statute, if it isn't signed, does that cause any problems with prohibited? No, we have two attorneys on.
Doesn't prohibit that discussion.
What's that?
Prohibit that discussion.
No.
I like having it in there. I think
just
it's
think-
it's helpful. I think that we sometimes struggle with how much information can we share, like what's really allowed to share versus having a release of information. You have that conversation and the defendant knows what and if you're going to share with the victim. So I like having it in there, even if it's a backup. And I wouldn't think it would prohibit anything, right? It would make it more open.
No, I was thinking that it might prohibit an agent from having the conversation.
Oh.
That's what I was saying it would prohibit. No, a release of information certainly wouldn't prohibit it. I was just wondering if that would be somehow a roadblock
Okay.
in any other way.
Meaning if
But-
they didn't sign it, that then they couldn't. I got you.
But I think it does read that way. So if a client says, no, I'm not signing this release, and we have it as number 4
Yep.
of the things that, in order to even proceed with a request for reunification, that will block our ability to proceed with any of these
Right.
steps, at least how it's written now. I would think that we would have to figure out what we would do if the client said they would not sign it. Because maybe there's just things that they wouldn't want us talking about. It could be medical, it could be mental health, it could, I don't know, there might be just some other reason. And they still might want to reunify, but they just don't want us to be able to say anything to the victim. So what do we do in these cases then that, you know what I mean? That you wouldn't want to be like, is that what we are getting at a little
That's
bit,
what I'm
right?
getting
Yeah,
at.
exactly. Like we wouldn't want to be like, okay, so and then never more can we talk when maybe they're just trying to protect a portion of their information from being released.
And that's good discussion that I don't think we had. The intent was, if you aren't gonna let us talk to that victim's not safe.
Sure.
And so
That's fair.
it's not, if we can't communicate our concerns and working together in this, then we shouldn't proceed with reunification but you can always clarify in a release of information, what
What-
information you're gonna share. If the client says, I don't want you talking about my medical issues,
Correct.
you will limit that on a release. Now, should that say that in there? Maybe, but the intent was saying, if that defendant won't let us talk to the victim, we don't feel that victim safe.
Yep.
So
That's true.
reunification.
So what is it in the release, or, what is being released?
And our releases have those check boxes.
Yes, what you can release or what you're gonna talk about, and, maybe I assume, because I've been at the committee and we've been talking about this for the last year, I'm gonna specify in my release of information with this defendant, safety issues, compliance with conditions of supervision, those, I'm probably gonna spell that out, but will everybody know that?
Is it a release, like where your subcommittee would say, these are the things that are a must, that the information needs to flow? It's okay that these other things are not, is there some other guidance in your subcommittee that you'd want to give in this? So that what you're talking about, Carter, is that somebody, either that if there's a difference in approach in different jurisdictions or whatever, that we would want to say, well, at least for these purposes, we need consistency on these releases if we're going to go through this process.
Maybe
Somebody talking?
I thought maybe I heard something else.
Elaine?
I was just, I think that what I'm just had paused about was what does it mean, which is, I think, part of this discussion is what does it mean may impact their safety? I mean, I just think that's open to so much discretion. At the same time, I'm struggling to think about, if making check boxes, right? And certain things that are the shall communicate versus that might not apply in different situations. So I was just stuck on what does may impact their safety? What does that mean? And that may differ between agents.
Yeah.
So you would like more clarification on number 4?
B4.
Yeah, again, I hesitate with like a, check the box, like we can talk about this topic's off limits, because, in different contexts, there might be something that does impact a safety issue, given particular circumstances at the time. And I think going back to what I didn't catch who said it, but also the issue with the conversation with the client, of just what that means. Like Tracy, what you were talking about, like the intent of this was that this information, we need to be able to talk to the victim, but what does that mean so the client understands it, the defendant?
Right.
So maybe we can just put a little, another sentence noting, information related to, well, I'll bring it back to the committee, and then I can look at that before expanding that a little more on what information would be relevant or considered. Because I do agree, it's going to be different in every case, right? If there's children involved, or if it's just, so I'll bring back some direction on trying to expand that sentence a little bit.
Yeah, because some of that too, I think would be if they're in treatment, can we talk about their progress in treatment?
Yeah.
I mean, right now you can say they're compliant or not with just general
Yeah.
rules, but you can't say this is what they were working on in treatment and how it affects you or something to that.
Or a release of information should be specific to what information will be shared on each case or something, so that directs the agent identify on that form what information on case by case you're going to be releasing with the victim.
Yeah, I also think you don't want it to be a roadblock to the trust between an agent and the defendant, right? And so that kind of further delineating what this means. The treatment example was one I was thinking about while folks were talking, but.
Marlon.
Just another kind of clarifying question. Who's initiating this reunification?
Well, in the policy, the victim has to be willing, and there has to be identifies here. There can be the agent must confirm there are no active criminal orders, that the victim must be willing. So that stuff is spelled out in there.
Yeah. Yeah, okay. And
So if
then,
the victim says, I absolutely do not want any reunification, it stops there.
yeah.
Or if
And
there's
then,
an order.
The only other thing I see is that I have 3 pages, and the last page says that it's page 3 of 2.
Oh, okay, thank you.
Yeah, that's all. Thank you.
Ours does not here, but
1 of 3, 2
Updated
of
it
3,
last
3
time.
of 3.
Yeah.
maybe the one that got sent out online has it.
That's what I have, but it's 3 of 3.
You got a bonus page.
Okay. Okay.
What else for this one?
Couple of things if I
Yeah,
can,
of course.
on there, just under E-training, it talks about DOC facility case managers. If we have that in there, I don't know if under applicability, we should add it just talks about Minnesota community supervision, and doesn't talk about the facility or.
Good catch.
in there.
Good catch. That was supposed to be on there and that somehow got missed. Thank you.
And then under B, under reunification, it talks about and/or DOC victim services. Wonder if we want to just take out the DOC and just have victim services. Counties also have victim services that victims work with, and that would, it just kind of leave it open for DOC, county victim services or others.
Great. Yeah, nice, John.
Oh, and then I know we talked about at-risk last meeting and the definition of it, so I'm sure that will shake out potentially.
Definition.
Yeah, during the definition discussions.
Mhm.
So I just had highlighted that.
Thank you.
Do we want to narrow the scope, the training? And maybe you've talked about this in the past, I'm new here, but IPV versus E2, I guess, IPV reunification principles. Victim-centered approach corrections training must be approved by the Domestic Violence Steering Committee, which includes Violence-Free Minnesota and corrections agencies. Is that necessary? Will that over time maybe change? Would they change their name? Would we not go to broaden our scope of where we would get information to create.
That was a discussion that we had the last time too, and this is kind of so what was questioned is, where do we do training? That was a big discussion last time. Will it be in the training academy? Will it be at a MACAC conference? Will it be housed in Hennepin County? And so if agencies are doing IPV training, bring it back to the steering committee. And I think to decide if we feel that they're incorporating it. I still struggle with this a little bit because where does that training housed? Is it for the domestic violence steering committee, which I'm on, to look at Hennepin County? I'm just using random comments. Hennepin County, who does their own internal training, they don't send to the training academy. Are we going to look at their curriculum and review it and approve it? No, I don't want to. If that's what Hennepin County creates as their training, or same thing with the training academy. Does it lie on the training academy? There's so much training already that they're doing. Should that be a training line there? So that's where we struggle. And I think we struggled with the last meeting too, is, how do we make sure the IPV principals are being trained universally?
Right, with fidelity is what you're
Yes.
getting at, is that piece, yeah.
Is that to be accomplished by this policy, and do we narrow the scope this much? I mean, that's really what we're talking about, right? I don't know that it's necessary on the policy personally, but not that it's not important. I just don't know that it belongs necessarily.
But we're talking about coaching and those other things and fidelity and our other policies. So I get it. We struggled with this issue too.
Fidelity, but we don't name where you have to get your training and how you get your training, who approves the training.
Yeah.
Well, it kind of goes into a bigger question too, and I don't know, Commissioner Rickman-Brecky, if this is where I remember this from prior conversations. Does this subsection go in the policy that we approved on training anyway? Within the first year, you get these things, and then do we add this there?
Oh.
Do you know what I mean? And then, like, we've already adopted the IPV reunification principles here at CSAC. So then it implies those are the principles, right? So then when we get into the fidelity or the QA, that goes in that other training policy. So all I'm saying is I wonder if we can figure out how do we, make sure that this is in that one. We're gonna have to bring that one back anyway. We've realized that, even though it's been approved because of a variety of these things, but yes, maybe it's not here, but it's there. And then from what you're talking about in the domestic violence steering committee, you have a charter for that, if I'm not mistaken, for that committee, or no? Oh, okay. Okay, well then, because what I was thinking is, like, if a lot of these, like the EVP advisory committee, right, has a charter of who's in it, how many voting members are there. I was just curious if this is going to remain a statewide domestic violence formal committee.
Some democratic process to it is what you're suggesting.
Yes, that would say, you need to have, whether it's Violence Free Minnesota or in the future, some other domestic violence nonprofit or community group, that's written out in almost, you know what I mean? Like, we have all these separate committees, because I think that does make a lot of sense for like the health of CSAC. And when we went over that kind of org chart and the process, I think I would speak for myself, and I think for MACAC to say, we hope the domestic violence steering committee, making sure I get the, stays as a committee, just like EVP advisory, so that all of these conversations for years to come would funnel through, and we could, send things back. What is QA? Are we training? Do the IPD principles change? Why are they changing? So I'm wondering if that's a way to get at like who's included and still become like a standing subcommittee maybe of this CSAC group. I don't know, just a thought.
I don't know. It's different than what we talked about on the wall chart thing, because if you were to go back to the discussion last time, and again, I'm new here, so the idea would be, and not that we can't change it, we have discussions and change things all the time, but that the EVP advisory committee would be the only one, and then there would be subcommittees out of that. Now, for the foreseeable future, it does make sense that Violence Free Minnesota and these groups, domestic violence steering committee, as long as they're up and viable, that's where that goes, right? but what if that changes? That's all my thought is then, well, we have a question about something else or things change over time and maybe that's not
Sure.
the most, or maybe that group is disbanded
Right.
or whatever it is.
True, we did that. In some ways, I've always seen this domestic violence steering committee being a subject matter entity that is a little different than some of the other subgroups, but
For sure. Today.
right now, yep, exactly. As
Yeah.
it stands, so.
Yeah.
You can talk about a successor organization or, assignees, but who knows? I
Mhm.
mean, it's right now, I'd say who knows a lot.
So where does that leave us?
Yeah.
Um,
What can I bring back?
Okay,
And what can we?
Well, there is nothing that precludes, obviously, the domestic violence steering committee doing what you
No.
are doing and
No.
whether you have a formal charter or not, right? Like,
Mhm.
and that conversation we can continue to have here as far as the formality of it in conjunction with CSAC for sure. Again, no decisions by any means.
I just think you could just delete number 2 and we just continue as is.
Yeah.
It doesn't change the way that we interact with Violence Free Minnesota.
Yeah.
That's the Violence
We
Steering
just
Committee.
delete.
2.
Okay.
And then the E1, perhaps that goes in the training QA
Oh, I see.
policy then
That's what you're talking.
is shifting that one perhaps. Or making sure it's there. We already
Okay,
talked about the
so
risk
leave it
management.
here for now.
For now.
And then eventually our goal is to roll that into our training.
Correct. So I would leave it here for now. And as we look at all of our policies and how they
Okay.
integrate, where do these certain things
Perfect.
get moved? Yeah,
Perfect.
Yeah.
So any other?
Now, what else? Other thoughts or questions?
So do I bring this then back to, or do we give it to all deliveries?
No.
No, it's still.
I think we need some more clarification for sure on that.
those.
Yeah.
Okay.
And so then we'll, when
Bring
is?
it back here.
Yes, I don't know
Okay.
if next month is too soon or if it needs to be December. We can,
I think we have a meeting. Just gonna look to see when the November meeting was. I think so we meet here on the 19th?
we're gonna,
We have to talk.
I would have to talk
Let's
about
talk
that
about that.
coming up.
I think, let's plan on bringing it back in the November meeting. That will allow us enough time. I don't think they're big enough issues that are gonna take us. We'll just roll it. I'll do it I can bring it back in November
It's nice because the conversation.
or whenever our next.
Yeah, right.
Yeah, okay, that sounds good. And then I do see a hand up, Kevin.
Yeah, thank you. So the EBP Statewide Advisory Committee, has the 2 deliverables, 8 and 5. And what you're talking about, training, coaching, and quality assurance. And so with that policy and the other policy as well, we're creating an implementation guide, and maybe implementation is the wrong phrase or term to have in there. But Tracy, I would ask maybe if your group could put something together, like how agencies could have this training and what that might look like. And so it's similar and they don't have to be identical, right? But like the same information is being taught, trained, presented across the state. So if Ramsey Hennepin's doing their own, Statewide Training Academy is doing their own, they may not be exactly word for word, but very similar. Or how they could get these resources, or what best practices, what EBP is out there for this type of topic. And then we could add that into our guide.
Well, it's all trained on the IPV principles. This training comes from the principles that were already approved.
Yep.
So I would be using that manual. So are you?
Yeah, so maybe we just attach the manual to it, or just have a link to where places can access it. Or anything regarding this topic where you think agencies would benefit from.
So if I'm hearing you right, and so basically under E1, like what, or anywhere like you're saying, Kevin, when we talk about IPV reunification principles, we are linking to the CSAC document of those principles. So
Yeah.
like those are the ones we're talking about because those went through this committee, right?
Yep.
Yes.
So,
They
and then the
were
manual
approved.
might shift. I don't think, we've talked about not wanting to link all of those things. That might just be, again, a addendum, like a resource,
My
right? Like
understanding
you
would be
said.
under one of the, it's under the attachments. It's listed.
It is, yeah.
Yep. Oh, the principles, yes, they are here. So we would all have that connected. Yep, you're right. And that's in the definitions and stuff too.
So for example, like motivational interviewing 1 and 2 is a requirement. And like in that we have where agencies can access that, same with like coaching, what that looks like, how agencies can access it. And if you want to take next steps to improve and not just do the bare minimum, how you can do that. If that makes sense.
Right, like recommendations for, you could do tapes, you could do, I mean, there's like a variety, like a menu of other options outside of a policy that people could use as a resource. So I'm wondering, are you,
Yeah. So regarding this topic, if there's something similar, we could add that into that guide. If we are going to put that in deliverable 8, coaching, education, quality assurance.
okay, I think, so if there's supplemental stuff that this group thinks would be helpful to agents, just like we have this supplemental information on any of our EVPs, that we could add that to a same place, is what you're saying, so that we go to the same place when we're looking for, okay, we're doing this for sure, but hey, I'd really like to know more on lethality risk assessment tools or whatever, like you have a place to go to research that or to look at that.
Absolutely, yes.
And where is that housed?
Well, we are working, I think DOC is working on that, like the space in which these policies and things like that will be. But it's not, so it's a to be determined,
Okay.
but kind of a note, I guess.
Okay.
For
It's already
Okay.
there.
the other thing I was going to mention too, it just came to me on the E1 is it says within the first year of employment in a specified position, supervising agents in DOC. I think it's implied, but maybe we can work on that language because I think it's really that prior to doing, I'm just wordsmith or not wordsmithing, I guess just spitballing here, but it's really about prior to working specifically with cases involving IPV, you get this training because you might have agents that don't do this at all. They wouldn't have to get this within their first year, or maybe even at all. So I'm just wondering about, like, it doesn't mean every single agent in the state of Minnesota would necessarily need this if you're not doing this work is all. So
And that's why I think it was left generic is because we did statewide, we've done 15 trainings already on the IPV principles. The DOC made it mandatory for every agent to do it because you will likely be working with a victim, even though it's not through IPV or domestic violence. So we've offered that statewide. So it would be at an agency discretion, but it'd be mandatory if you're working with domestic violence and.
right, so I think it's just, is it,
that?
well, it just says in a specified position. I just was wondering if we can make that a
I think
little
it's,
bit.
that's uncertain. Like when I read that, I don't know what that means.
Yeah.
Okay, good cut, okay.
I mean, it'd be easier to say within first year employment, but if we don't need to say that, then, yeah.
I recommend it for everyone else within, like, because I agree with you. I think it's really great no matter what. Or sometimes you have multi cases and you might already be supervising somebody and then a subsequent DA case comes in. So I just, again, if these kind of shells are like, I just want to make sure like other ones too, where it's like, okay, well, this for sure you need it. And then it's highly recommended, right? That everyone gets it or something like
Yep.
that.
Okay. Can I just ask too, so I'm kind of reading the policy and it seems like to me it has kind of 2 branches to it. So in the sense that it's a reunification, but then there's also a lot of language about perhaps a client entering into a new relationship with this at-risk person. And so I'm just wondering if language about, it's kind of talked about in the criminal history, like when it talks about looking at that person's history, because obviously if there's a court order that says you cannot have contact with this person, it's shut down. But this could be a brand new individual. So there might not be that history between the two of them, but that truly that history of others that person has been involved with is so significant then. And so when I hear reunification, to me, it's these individuals that have already been together, and yet there's a lot of language about maybe at-risk people that still need to be identified and the process of that person becoming involved in that relationship, like the agent having some supervision about that. So the term reunification is just kind of throwing me off a little bit. Because I really like the idea of that individual's history being reviewed by the agent prior to perhaps this new relationship being involved.
Okay, so are you suggesting that be broken out a little separately, or
As it's reviewed, maybe just being cognizant of that? Because I feel like I go in a circle a little bit when I keep going through the policy, and it's taking me back to the actual court orders that exist. But there could not be any court orders that exist with this relationship that the person's becoming involved in. But yet there could be a very significant history of OFPs and DANCOs against one or more individuals. And then the only other thing I was going to point out is in number 3 is considering whether or not to just have the language there of any active ERPOs, that extreme risk protection orders that are fairly new. And they're not, I don't think many people are dealing with them yet, but it at least calls into a review of them or being cognizant of if that has been in someone's history as well.
okay?
Yeah, I think that's great, because now I'm back to D, like when you're going between victim and then at risk, and even the language within 1, 2, 3, 4, you have some of that at risk, and then 3 only talks about victim and 4 talks about victim. So it is great that we have all sorts of people on this committee, because it is to just look at that language, because then like, what are we talking about? And like you said, whether we're separating that or as you're going through it, what are we really talking about? Because an at-risk person most likely doesn't have a DANCO or anything else, right? But we just have this, like, we're really worried about you because we have this history and all these other things.
Right.
And so what are we going to do, or what can we do even?
Right, absolutely.
I mean, there's those things too, which is very different than the actual victim of a prior case or whatever.
Right.
Yeah.
Where the idea of reunification is probably pretty prevalent, right? Maybe they have kids together, they're coming out of custody.
Okay. Yep. Perfect.
The at-risk might be harder.
Say reunification, or, and I can't think of the other word, or
Right.
change reunification to like just contact or something altogether different. But then that's pretty huge, because that's what we've been calling it for forever.
Well, yeah.
But to your point,
Okay,
it does
we'll have discussion about that.
Really good though. Thank you very much. Yes.
Okay.
All right. Sorry, one last call for the IPV before I move on. Same thing, then I will move on to the peace planning policy. So we have John Marsalik, I believe, is in the attendee area, right? Oh,
There he is.
there you are, John. Good morning. As soon as I just have a quick, process question. That's why I joined this way. Don, is there a way to get like all the boxes, up for us to see in the room? Okay. That's why I joined, on my computer, because I can see more people on my computer than I can up on the screen. I may have missed, I do see John, but I also see Rhonda. So maybe you're tag teaming. I don't know who's going to start, but I will turn it over to you.
I can get us started. You're bringing up the case planning policy. Sorry, I just stepped away for a second and just walked back in.
Yes, hopefully you can see it.
There it is. All right. And I think Rhonda, my screen changed now. Rhonda's here too, right? Sorry, again, I just sat back down. So this policy has been before this group before, and there have been some revisions that have been brought back, some suggested changes.
So we are bringing it back again, and I was listening in on Tessa's presentation, and I'll kind of do a similar thing that Tessa did, and Rhonda just chime in as you see fit, where I just overview a lot of these things. And I know you guys are also going to be discussing definitions today as well, so we won't probably spend any time on there. But just starting at the top here, I know applicability was something that you guys talked about. So the language we have here, again, we're just striving to be consistent with what the other policies say. Scrolling through, I believe you can go through most, beyond most of these definitions here. I don't believe there were any significant changes to any of the definitions from the last time that this was presented to the current format. And like I said, I know you guys are going to talk about that. So let's go to page 2. And let's get into the meat and potatoes here of the key components. Yeah, so this is the topic du jour, the case planning expectations as it relates to medium risk. The language that previously was presented or talked about, I know there was discussion about how we can case plan to medium risk with a lot of uncertainties still out there. And so the language that we are presenting today, agents must case plan with all high and very high risk clients under supervision and are encouraged to case plan with medium risk clients. As an additional document that was sent to the CSAC group, the issue of medium risk was kind of addressed through that. So there was a lot of discussion about how we can case plan to mediums or not in our current situation versus what the future will look like. And so in the supporting documentation that was provided to the CSAC group from JRI, we felt that there were some key components that needed to be addressed. And so I don't know if you want to talk about that now, or if you would like me to continue going through additional aspects of the policy.
I take your lead, Jen. However you want to do it is fine.
All right. Well, can we let's just look at the let's look at the other document here real quick. If you can pull that up, kind of addresses the case planning Big Four. All right. So this is kind of where we were unsure where we can proceed with medium risk with the 4 issues at hand. So one is full funding. The legislature did not appropriate full funding to community corrections. The availability of adequate funding is essential to support our case planning responsibilities. The second issue at hand was the validation of the LSCMI. We just find that it is important for us to be able to validate the LSCMI locally in order to establish a proportion of clients who we classified as medium risk. And the next issue is the workload study. So the ongoing workload study provide necessary data on agency capacity and resource allocation. We also believe that is critical in order to establish where we would go with medium risk. The last piece, number 4, is supervision standards. And so this is another deliverable that's being worked on right now. The development of the statewide supervision standards, including the minimum contact requirements, is also currently in progress. And so we just, this matter of medium risk has been talked about over and over again. And so we discussed providing some of the reasons why we didn't feel like we could explicitly state, well, yes, we are going to case plan to medium risk, which is something in the commissioner's response really wanted to get addressed. And I think where we landed on the language, to encourage agencies that have the capacity to do it right now, that they are able to case plan to medium risk. But in the meantime, and it says here on the bottom, upon completion of these deliverables that we're working on, whether that be the LSCMI validation or the supervision standards, and if we secure full funding, we obviously are going to revisit these policies. And so to allow us a little flexibility, to allow us to be able to say, yes, here's the current expectation for highs and very highs, we kind of took a step back on the mediums and said, here are the issues at hand that need to be addressed. before we can say that we can fully invest in case planning for medium risk clients. So are there any questions about this document? Or Rhonda, did I miss anything?
No, and just so the committee, CSAC knows, there was so much conversation among the 3 delivery systems regarding this, and this is as good as we got to get people to agree without having all of these factors in place, the difficulty in creating a policy.
Yeah. I really appreciate this, and I think that this is philosophically, I don't think you're going to have much disagreement that we would all love to do the best quality evidence-based practice work with medium, high, and very high individuals in the state of Minnesota. Like, I don't think you're going to get somebody saying, no, I disagree with that statement. And we have these 4 things that you just walked through that have too many what ifs on capacity and ability. And what we don't want to do is build in, again, future mandates that we don't know we can actually do or can be funded for appropriately, and end up in a situation, like I think other agencies sometimes have faced. And so I appreciate this. I appreciate calling these things out and saying, we are not saying that this is not a best practice or what our future desire is, but we just have too much, again, uncertainty. And so we need to table this particular point, and let's get really good at high and very high, and get a policy we can agree to, and then revisit once we have outcomes to these deliverables, these 4 that you just walked through, and consider whether or not we can add medium.
Yeah, I think, the group really did spend a lot of time discussing this, and I think the struggle is the uncertainties. And when we're doing all these things at the same time, when we're trying to validate a tool at the same time as establishing supervision standards and doing a workload study, while you're trying to define what it looks like in relation to case planning, it becomes really, really complicated. And the best way for us to kind of lay that out is here's all the complications and the impact. And I think we had really good discussions about, well, we have to revisit these policies will need to be revisited. And I think we'll obviously be able to do that, address this, when we get all these things figured out, and at that time, then when the policy comes back for review again. So,
Great.
Do you want to jump back to the?
Okay, go ahead. Yeah, you can go back to the policy then.
Good. A lot of the stuff is consistent language that has previously been seen. Agencies and agents must use a document evidence-based case planning process. That incorporates ongoing processes that include those things there. Assessment-driven approach talks about the LSCMI and/or appropriate tools such as the DRA. Obviously, you guys were talking about risk assessments this morning. Focusing on criminogenic need. Encourage that case planning target the thinking and patterns of the central 8. And we have some language in there just about non-criminogenic needs may be addressed as well. We want to align with the R&R principle. I think there's some additional responsivity definitions further up. Again, you guys are talking about definitions, I think, later on today. There was some feedback in the last meeting that we presented on in the responding to client behavior. So there was some language that had been incorporated out of the behavior response memo. And it really, the feedback at the time was that the language that was included kind of it didn't take over the policy, but it was really robust. And there was a lot of language in there about the responding to client behavior. So we tried to peel that back a little bit and speak just broadly about the responding to client behavior. And this, discusses or points out incentives and sanctions as part of that responding to client behavior as well. So language that had been previously been presented was, I would say, kind of condensed down. And this is the language that we present today. So this is what I would say with the medium language being the change, and then this would be the other aspect of this policy that I would say would have been the bigger changes from the last time that we were in front of this group. Integration with CSTS down at the bottom there in G, that continues to be the same. And then we have our roles and responsibilities with agents, supervisors, and administrators. And then there's also the quality assurance piece for data collection and metrics for which we want to collect through CSTS, periodic audits, and the analyzing of data. So, Rhonda, anything from your lens that was missed?
Nope, well done.
All right, thank you too. All right, I will open it up for questions, comments, thoughts. I appreciate the summarizing of the response, responding to client behavior as well. Again, this iterative process back and forth to your subcommittee with the different, information coming in from all sorts of spaces. So that kind of brings it up to a higher level, but still, I think really highlights the importance of, again, what you state in here, purposeful, consistent, tied to the individual, et cetera. So without being too prescriptive. Yeah, Kevin.
Yeah, I just want to say great work. I know this is a heavy lift of, I think, of all the deliverables. This is probably one of the top. And just great work, great collaboration, great teamwork to put this together. So great work. Thank you.
Thanks, Kevin. Others. Hearing none, then I am again going to suggest that we can move this to our agencies then for further discussion and put this on next month's agenda for further discussion, possible action. All right, and we have an inside joke here as co-chairs that John Shiro does not give breaks. And so you're lucky that I'm before John's section here. Teasing him. So is it okay?
I had it on my
Co-chair?
agenda.
Did
If
you?
you did not,
Oh
I was
my
gonna
gosh,
call.
I love this.
I know. We're on the
So
same page.
what do you think, 10 minutes?
We're aligned. Yep, 10 minutes.
All right, how about 10-minute break? So I have 10:28, so we'll come back at 10:38.
So welcome back, everyone. Maybe give it see if everybody's online with us. What time did we tell them?
10:38.
We did.
We're
Okay.
close.
Okay. Well, looks like we're getting everybody online. Well, welcome back, everyone. So we will move on to the workload study update. If you remember our last meeting, we talked a little bit about the in scope, out of scope. So the couple of the committee members got together and created a document for us, which is super helpful that we can kind of vet through a little bit. And then also, it looks like they have the timeline, maybe go through that a little bit. So we'll turn it over to Carter Deers, who is on the workload study design committee to go through this for us.
Sure, thank you. So I have two documents. We're going to kind of talk about them sort of at the same time, and they do relate. And so we have the timeline, which is laid out here. We're kind of entering into, I'll just go into this just a little bit if you're okay with it. We're about to enter into what we're seeing here as phase 2. So I think all the delivery systems have, or very soon will be identifying all of the folks that will be participating in the workload study design. That kickoff is December 2nd and 3rd. We are having discussions about the timeline, if it's realistic, can we actually get this done? The concern is that we're too late in the game to where we can, the concern is we don't have something packaged and ready for the legislature when it's time for that. My other concern, of course, is that when you do workload studies, sometimes you gather lots of information on some things, but you don't have enough information on something else, so that you say, well, how do we deal with that? Do we extend the workload study to gather more information on this sort of task or whatnot? But that's just kind of inherent in workload studies. And so if you take a look at the workload study timeline document here, when we enter into phase 2, we're going to work on like, how is it that you design the interface with the agent? We're thinking about maybe like a smart sheet feedback so we can collate the information much quicker. And so the task of that group is to really take a look at all the documents that the leadership team has created so far and move that into kind of tires to the pavement and get that design ready for the actual implementation and starting of the workload study itself. If you turn to the draft Community Supervision Advisory Committee, Workload Study Design Committee in and out of scope designation. Reason why I kind of wanted to come up with this, and the reason why I brought it up at the last meeting, is we are having in our leadership team probably more discussions. It's taking a lot of time out of our meetings to discuss what are we going to study, what are we not going to study, and I thought it maybe made the most sense to bring it here to make that decision so that we can go back and move on and move forward. And so what I think I did here is outline, the other document is from MACPO. Did that get printed off? That was responded to. MACPO kind of stated there what they felt as though we should be studying. And correct me if I'm wrong, Kevin, but the argument is even if we don't include it in the funding, at least we have it studied. I think the counter argument is we only have a limited amount of time, and why are we studying things that we're not going to fund? Secondly, how is it that we're going to study things that we haven't necessarily agreed upon? And so what I wrote up here is a potential for a resolution to that of what I've heard is kind of the mainstream arguments of what should be in scope and what should we leave out of scope for now in order for us to move forward. And so I'll just outline that. In scope would be an adult and juvenile felony cases, adult and juvenile gross misdemeanor cases, third adult juvenile misdemeanor cases and related tasks, with the exception of non-DWI traffic cases. I think MACPO said we don't want to just leave it just to targeted misdemeanors. That leaves out, disorderly conducts, which are commonly pled down to from domestics, which does make sense. I hope that this captures that so that we're not funding and studying speeding tickets, driving after revocations, and that I think would bring the funding more to be more equitable. And so that I think is in the nature of what was intended by the legislature to fund. Also in scope would be pre-sentence investigations as they are required at least for felonies, but also we'd be studying gross misdemeanors as well as pretrial bail evaluations as they are also required on those ones that are required. This leaves the out of scope, which parses out pre-sentence investigations and pretrial bail evaluations from pretrial supervision, which could have been included, but I would suggest the rationale for including pretrial supervision, excluding pretrial supervision is a wide range of involvement in pretrial supervision. Some counties have a very robust pretrial supervision program, some very much less. There's no agreed upon scope of what pretrial supervision is and what the kind of the gold standard or what the standard should be or what we actually should be doing as opposed to what we should not be doing. Finally, if pretrial supervision was included, and once not included, it would add further inequities and be disrupt to the current practices. So we could be funding something that we don't really realize that we could be I think we could be funding one county far more inequitably than we even are now. And I think the idea of this is with the money that we have in the legislature, let's argue for full funding and incremental change as opposed to biting off quite a bit that we don't know a whole lot about. Second, and I'm kind of going out of order here, is diversion or deferral from prosecution cases. Rationale there is it's not within the authority of probation departments to be doing diversions. Certainly a lot, or I would say even most that are collaborating or working with their prosecutors in their own counties to do that. But that is not within the scope and it's not what the legislature was intending to fund. Thank you.
Thank you, Carter. Questions, comments?
Just for clarification, under the in scope, under pre-sentence investigations, you note on there requires PSS on felonies and provides ability on gross misdemeanors. So are you counting misdemeanors and gross misdemeanors that agencies are doing, or only the felonies?
All pre-sentence investigations.
All pre-sentence. And how
I think
about?
we are right now, correct?
Okay.
Yeah.
What I was gonna say is yes, and I wanted to add, nice job, Carter, is just because we're saying what's in scope here does not mean it will be part of the funding formula, right? It's just maybe that's an obvious thing. We're just saying we're gonna study these and then take those results and, look at them. But what we know is, again, from an out of scope, if you're not even being asked by the state to do it, why would we be studying something, right? That sort of thing. So I just want to make sure, but I think what we're saying is that as the agents identified that do PSIs, they would just be marking that they're doing PSIs, how long it takes and what type of PSI it is, what level of offense it is, et cetera. And then we'd analyze that later.
And how about predispositional?
Yeah, same.
Okay.
Right?
Juvenile
We didn't talk about that.
predispositional?
Oh, PDR? Is it, you're talking about
Yes.
juveniles? Yes, sorry. We also have pre-plea PSIs and I'm
Yep.
hoping that's out of scope because that would be a whole other thing that is
Okay. So,
inconsistent across the state.
okay.
Other questions? Thank you, Tracy.
Tracy, would it make sense that if I abbreviate the third dot there to include predispositional investigations? Is that what you're, does that make sense?
I maybe, yeah. So I just was making sure that it was all predispositional, just even the ones that aren't required, which you clarified. But I think predispositional would help also.
Yeah, PDRs make sense.
And did you say PPIs would not be included in this?
That is
That's the argument.
the argument.
My only question about that is, it's pre-plea versus, they're still doing the work.
And we're still court ordered to do it.
Yeah. What's the difference if it's prior to the plea or after the plea?
We're just studying it either way, though. I mean, if it's included in the workload study, I don't know that it makes a ton of difference, quite honestly, because what we're saying here is what is it we're going to study, how long it takes how long does it take to do X? And it's inconsistent across the board, pretty consistent predispositional investigations, pre-sentence investigations. It's pretty inconsistent with how much and how many people agencies are doing a pre-plea.
Okay.
I think that's, and it is hard because the judges ask us to do a whole lot of things but that the state legislature may not say that we have to do. And then we have to work with our bench and our county commissioners to say, like, what can we do? As an example, Scott County, we don't have STS. Judges could tell me to do STS all day long. We don't even have the program, right? So like, it doesn't force us to have to start a program either, or what's the other example? Oh, criminal history summaries. We do something with our county attorney's office that our county chose to pay for a position to do something, but the state's not asking us to do that. That's a county choice of saying we're okay putting resources towards this one thing. So I wouldn't want to say, okay, well then we should study that to see how much it costs, because that would not be like, that's not, again, what in the statutes are saying we have to do. That would be county choice, so that'd be out of scope. So I'm just trying to use like unique things to us that I would try to like compare it to. Anyways.
Yeah, I think it's important to stick with the statute and the mandates. I mean, what judges and courts order is a whole nother ball of wax, but that's just gonna like, we gotta stick in this branch of government.
Right.
Funding.
Yeah, makes sense.
And yes, because the judiciary should be funding then some of, there's an argument for somebody else to be
Sure.
funding the things the court orders us to do that we don't have in place.
Correct.
Sure.
Or they would lobby to change
Right,
state
exactly.
statute to
Exactly,
include it, and then we would, then we would be
Then
asking
we
for
would.
it, but yeah.
So, yeah, I think that's important to stay true to that.
Kevin, you have your hand up?
He wrote the really nice letter.
Thank you. So thank you, Carter, for the explanation. I would say, and the purpose behind the letter is, if we're going to be looking at things, let's look at everything and break it down, but totally understand the rationale and appreciate the in scope and out of scope. I would say maybe just for the purpose of this study, to include all misdemeanors, and maybe that's when we break it down and we can have a better look of like even the traffic ones, what are being placed on probation and what aren't, and what that number looks like. I agree. I mean, I don't think a speeding should be placed on probation, but maybe it's something that we look at and that's a conversation after we have this study, to have that conversation with the bench. And what is the purpose of putting somebody on probation for a traffic offense, and what type of traffic offense? And then just for clarification purposes, is a juvenile certification study going to be considered? Is that going to be included as a PDIR, or is that separate, or are we not including that? Because that's a lot of time and energy and effort that agents put into certification studies for the juveniles.
Here'd be my response to that. When I totally agree, it takes a ton of time. I've done a handful, right? But when you have a certain amount of time to study how long it takes to do something, they're so infrequently ordered that I don't think we're going to get enough information to actually make a decision on how long it takes. And we're splitting up, and we're basically using this information to kind of divvy up or split up funding. I just don't think it's gonna make a whole lot of difference one way or another. Sorry, go ahead.
No, I just raised my hand because I don't want to interrupt you.
Yeah.
Just a clarification point for me on the workload study. Is it looking at the time to do a PSI study, or is it looking at the numbers that we do of them, or a combination? So looking at how long it takes to do say a PSI, or how many PSIs we're doing, or a combination?
It's sort of a combination, but not exactly like that. Yes, that have been in the meeting. Please correct me if I'm wrong. I think what it's doing is just taking a look. How long does it take to do supervision on this person? And what are the tasks related?
And then they're gonna take, so part of the other thing that we're working on the workload study is working with evident change on our data agreement. So then what's the data elements we're gonna pull at an aggregate level, so that the formula can be studied or generated, right? And options for that formula. So then they would say, okay, so it takes this much time to do ABC, and Hennepin County has 2,000, right? Like this is how, so yes, it's like a combination, but the individuals that are being studied will just be saying PSI, felony, CSC 1, 16 hours or whatever. I mean, so it's going to be more like that.
Yeah, that makes a lot more sense to me than to not have to include everything, because you're looking at the time, snapshot of time it takes to supervise a client, and then you could theoretically apply that to, Molly has 3,000 clients, so this amount of time for each client equals whatever. Thank you.
Perfect. Any other questions or comments? Perfect. Seeing none. So we'll do with this one, it sounds like, is we'll bring it back to your organizations. And then next week, next meeting, we'll come back and as CSAC, we'll have another conversation on it, and then we'll vote on approving the in scope, out of scope for the workload design committee so they can move forward. Yep. Yes. Go ahead, Carter.
Do you want me to add the PDIs, or do you want to make a note to that on everybody's, or how do you want to do that? Because or is that a change that we'd want to make to bring it back, or do we want to not make any changes and just have this?
You're okay to add or not? I added it that it was a discussion on ours when we bring it back to, I would imagine when you're bringing it back to the organizations, people would add that similar to the other discussions we have, but if you want to update it, you sure can and send it out.
I'll just leave it
then. We're fine. Yeah. Sure. Thank you.
I do want to say that because we're concerned about the timeline and like getting done in time, that we still have quite a bit of because these meet every 2 weeks and meetings in between. And so I have to say that, not to say obviously that we can't go back and talk about it, but we need to run under some draft scope. Otherwise we're sitting here, you know what I mean? And now everything is now another month delayed. So it doesn't mean that the study is not going to start before a decision, you know, before we kind of come to that. But I would say that like a soft, I don't know what the right word is for that, but a soft motion or a head nod, like we are running, I guess, or we would like to run under kind of adding the PDR information to that under this, and then we can add, you know, as we come back next month. But unless this committee really wants the workload study to stop, you know, for a month, I kind of doubt that, but.
Are we okay with the design committee running with the draft format, adding the PDI to it, and then coming back and doing a formal vote next time, which may or may not adjust that? I don't know if we need a formal approval unless you think.
I just wanted to say that out loud because I
agree.
I have work that we're doing, and so.
Is there any opposition to having the design team moving forward with the draft scope, including the PDIs?
You want a motion or you want no objection?
No.
No, I think no objection would be fine at this point. I do. Okay. If the design team's okay with that.
I think that's fine. I just was more about.
Okay. Yep. Perfect. So we'll have them move forward with the draft design, and we'll come back and do a formal vote next time. So thank you. Thank you, Carter and design team. So we will move on to deliverable updates. Don, if you could pull it up, and we'll have you just kind of. Oh, I'm sorry. I missed. Sorry, Molly.
Okay.
On to you. I'm jumping that one. So
that's all right.
On to terminologies.
So thank you. CSAC terminology. So we do have a document on the definitions. And we talked about this as well a time or two ago, but thank you, Don. So what Don is doing as these policies roll in, if there are multiple definitions of a particular term, so you'll see that here, like a case plan or case planning, and putting this together into a document that eventually, when we get to approving, especially the ones that are currently, so that our risk the one that we've already approved, we'll have to bring that back and make sure we have those aligned. That's the training and quality assurance, risk assessment, IPV, case planning. I got the 4, I think. Well, and then the one, we also had the ISR. So I guess we'd want to make sure if anything, I don't know if it would be, but would need to change in terms of definitions. We just really want to make sure that we have continuity. But part of that continuity is being able to vote here formally on what we decide as the official definition of, you know, of all these terms. And so the document that you have is what we have so far. And I don't think we need to necessarily go through each and every one of these. I think that what we're looking for right now is just a general conversation. But the idea is once Don, is that, well, I guess this is a conversation for you all. I'm thinking that once we get to, it's kind of a timing thing, right? Like we have some that are going back, like the IPV one now is going to go back to the subgroup. We have risk assessment and case planning going to our agencies. It's kind of like a chicken and an egg, but I'm thinking we want to get closer to the policies, like the standard operating, the procedure part being adopted. And then we'll want to say, okay, what are all the definitions? Do we have them all? And then we take these to our agencies and say, how do you want the language to look? And we can hopefully have a small group that can maybe put some of this wordsmithing together to come back to CSAC for an official vote on the definitions that we can then insert into all of our policies respectively. Like that's some of the ideas we're having, but open to feedback on either process or content with this.
And one of the conversations we had, as you can see, there's boxed areas where there isn't quite alignment with the definitions. And as we move forward, some of the committees have been working together. We're starting to see more alignment. So that's why it may make sense to wait until we have all the policies drafted until we get to that point, because there may be more alignment when we get there. So it might be easier to kind of vet through some of these at that point.
And
I was
now
just
all
going
these
to add
Yes, go ahead,
I'm
Julie.
sorry, a content piece is I think at the last meeting, we were going to remove the first sentence of the at-risk person so that it just starts with, it doesn't have the romantic
Oh, yep.
piece of it.
Thank you.
Yeah, the at-risk person has
Just
changed.
to let you know, I did update the with all the draft policies that we went over today. I did update that. I finished that late yesterday afternoon, so I was not able to get that out to everybody. I will send that out today, a new updated one with, and it does take out that thing, that sentence that Julie just mentioned.
And it sounds like it might have shifted even more with the current draft IPV policy that Tracy presented to. I know another suggestion was to maybe the most logical subcommittee could also be giving this to the EBP advisory committee to wordsmith for us as subject matter experts in a lot of these areas and bring it back to CSAC too. As an idea for recommendations as well. So I don't think a lot of these are necessarily far off. Some are just shorter. Some just had more, so I don't know that we just want to have that continuity going forward. So. So I don't think we have.
It'll be useful to the agency when they do the final review also, just to make sure that we didn't miss any.
Yeah. So I don't think there's any action by any means. It was just more of an update on what we're doing with these as we are going forward, and so we'll be bringing it back.
Perfect. Thank you, Molly.
So the second box, they look like they're the exact same.
That's what I thought too.
Missing
I'd seen
something.
that.
So I think I've been trying to update these two like that, so. I already put that, not that, I mean, we do whatever, but I already put a tickler for myself when we renew that policy to change that to the common language, so. The most common definition.
All right.
Perfect. Thank you, Molly.
Yeah.
Then on to the deliverables update. As you know, Don has the Excel spreadsheet that he sends out before every meeting. We have the updates from all of our committees from there. So Don, you could pull that up and just kind of run through quickly what some of the updates that we have on there are. I'll allow you to read the bolded. I can't see them that well from back here. So if you can.
Yes,
that'd be great.
So ISR policy is done and complete. We did do a review of the IPV policy. Sorry, have screens in the way. So looking at developing a comprehensive outline for full set of supervision standards. The committee, JRIs, has begun the review of context standards across delivery systems and is working to create a draft of what would be considered minimum context standards. The next steps are to create a basic grid with the 5 supervision levels with minimum contexts. And then develop proposed prioritization timeline for a full set of supervision standards. The committee met and reviewed some of the standards that were previously submitted when CSG was involved. Next steps, there are a lot of different standards and assessments, trailer tools being used. Also, we do not have the LSCMI validated locally to set cut points for supervision levels. Looking at deliverable, 2, adopt the LSCMI as general risk and needs assessment tool. The validation study is ongoing by the University of Nebraska, Omaha. Data is currently being gathered as to how agencies are using the tool. Proficiency testing statewide is tentative for January 2026. Challenges that they're having is when proficiency testing is rolled out, all agencies will need to ensure that agents submit scoring answers. Looking at develop policy for use of pre-screener and or LSCMI. On 10/15, the group met and completed a draft policy, which we did bring up at this meeting. Looking at challenges, pre-screener creation is in the process and could take some time to complete. Final policy is difficult to complete until this tool is created and validated. Also, the LSCMI is in the process of being validated, which complicates the final policy. This policy is written as we sit today. Looking at continue identifying statewide pre-screener probation clients. The next steps that they have is the R&R policy draft is completed, and we discussed that today. And then continue to consider and make recommendations for supplemental assessments for special populations. That has been included in the draft policy, which we reviewed today. And completing with study and make recommendations for formal integration of MinStar 3.0 for supervised release or ISR. That is being reviewed by the executive committee. Provide additional recommendations for supervision standards and for misdemeanors not screened with LSCMI. This will be reviewed as part of the overall contact standard recommendations. Moving on to deliverable 3. Develop a policy for case planning with moderate and high-risk clients, automated case plan templates in CSTS, and establish a formalized evidence-based case planning process. The case planning policy was submitted today, and we're looking at taking it back to the various agencies. Prioritize development metric to assess fidelity and outcomes. That data is being gathered through CSTS, and then submit progress report within 1 year. We have prepared a memo. The working group has prepared a memo outlining how they will be able to address case planning with medium risk clients. Looking at deliverable 5, continue work with EBP statewide advisory committee to develop comprehensive and actionable set of recommendations. The policy recommended was presented to the EBP statewide advisory committee. Updates were made, recommendations will be made to CSAC in November's meeting. Then establish a baseline training for supervision. That policy was presented and updates were made and recommendations will be made to CSAC in November. Deliverable 6, statewide behavioral response grid. The behavioral modification memo was approved by CSAC in August's meeting. Moving on to deliverable 8, develop a policy requiring all agents to ensure training, coaching, and QA of the 5 EBP skill areas. This was presented and approved by CSAC during the August meeting. I do not have a update as to where that is in the DOC policymaking procedure at this point. And then looking at deliverable 10, the workload study. The schedule design committee kicked off or is scheduled to kick off December 3rd through 4th in St. Cloud. They're creating data requests for agencies, developing a way to parse out PSIs and bail studies from other pretrial activities. And the design committee is currently being formed. Challenges that they've identified, The discussion continues as to what's to study, more specifically pretrial and diversions. And there is an increased concern about timing. Can we get this all accomplished in the time that we need it for the 2027 legislative session? Those are the updates that I received.
Thank you, Dan. Any questions on the updates from the committees, from the deliverables? Perfect. Hearing none, we can move on to other business.
Right, thank you. So one thing that we need to discuss, and thank you for those that took the survey on shifting both the November and December dates as the holidays are coming upon us. So I believe, Don, that for the November meeting, the best suggested date that provides us a quorum is going to be on November, what was it,
21st.
From 9 to noon. And then the December date is the 22nd, is that right?
That's correct.
From 9 to noon, December 22nd, yeah.
And for those attending the November meeting, that will be down in the Itasca, which is in the Itasca room, which is the lower level.
And December would be here?
And December will be back in the Afton room. Yeah, that's
Okay.
correct.
So although, it's challenging to get 100%, I think there's a lot that was like 15 out of 20 of us or something like that. So it was, it's pretty good yeses to those two dates, but any other questions or concerns about moving those two dates? Oh, Kevin.
Thank you. I think the dates are fine. I'm just wondering about the time. I know some of our members like have children and getting them off to school. And so I don't know about maybe moving the time to maybe 10 o'clock or 9:30 might work better. But just want to put that out there.
Okay.
And then also traveling from the north to get down there in person, definitely be easier if we move the time back a little bit.
So I'm hearing a proposal to go like a 9:30 to 12:30 or a 10 to 1.
Yeah, something like that. And then obviously, if we get done early, we get done early. So it doesn't have,
Sure.
There is no conflict for either room if we move the timeframes.
A discussion on time from anybody else?
So this would be ongoing though, too. What you're saying is go from 9:30 or 10 o'clock on Wednesday. What's it? Third Wednesday, is that what we're doing?
On our Wednesday meetings as well? Is that what you're asking, Kevin?
Yes.
Okay.
Yes. Thank you.
What are we?
What's that more?
Today, he's asking me for all meetings, including the
correct.
one,
Yes,
yes,
yep,
okay.
yep.
I would have to do a review for the rooms just to make sure that the Afton room is not, because right now I've got it reserved from 9 to noon. I can do a check, but I don't necessarily think that'll be a problem.
I live in this area, so for me, that's why I'm not weighing in. I'm fine. I just am looking to others. I guess, does anybody oppose going from, and then which is at 9:30 or 10? Would people prefer?
I would prefer 9:30.
Yeah.
I would.
9:30?
too, Yeah.
Okay. 9:30. I'm
No
seeing a lot of head
opposition.
nods, so I'm not seeing an opposition. So we will move the November date to the 22nd, 9:30 to 12.
November date is the 21st.
Right, 21st. Yeah, we don't want to come on a Saturday. I do have strong feelings on that. No, sorry, the 21st from 9:30 to 12:30, December 22nd from 9:30 to 12:30, and our subsequent meetings in 2026, barring any room issues, we'll continue that time. All right, thank you.
Perfect. So next, we have the public comment. So is there any public comment in the room, Emilio? Welcome. Any online? I don't know if we had.
There are no more attendees.
No attendees. Thank you. And then we can move on to adjournment. Any opposition to adjournment? I don't think we need to do a motion and a vote, correct? So meeting is adjourned. Thank you,
Thank you.
everyone. Appreciate it.
Yeah, lots of
Thank you.
work.